This is Dr. Jennifer Jansen from the Zepf Center. You're listening to JJ's Clinical Connection, connecting you to clinical topics. Welcome back to JJ's Clinical Connections. April is National Minority Health Month, a time to raise awareness about health disparities and encourage better access to care for our communities. Today, we're talking about why this month matters, the importance of primary care, and how we can all take steps towards better health. We have two very special guests joining us in the studio for today's episode, Health Center Director Zeba Haydar and one of our primary care providers, Adam Wilburn. Over the past 2 years, these individuals have led the primary care team, connected with countless community partners, and relentlessly advocated for accessible healthcare in our community. Plus, they did all of this while running the clinic and providing excellent care to clients. Let's get the conversation started. Well, welcome to the studio today. Would you like to introduce yourselves to our listeners?
Sure. My name is Adam Wilburn. I am the primary care provider over at Zepf Center Primary Care. I've been there about 2 years. We started in December of 2022, and our clinic has grown exponentially in these past 2 years. We're serving almost about 1,400 patients right now, so it's been a busy time.
My name is Zeba Haydar. I am the Health Center Director of Operations. I am also a nurse practitioner with specializations in women's health, which is the area I've practiced in, and also family nurse practitioner, dual certified as well. So yeah, I'm not in a clinician role at Zepf, but I do bring that knowledge base in order to help with the direction of operations for our primary care practice.
Wonderful. Well, let's start with the basics. What is National Minority Health Month, and why is it important?
So, National Minority Health Month is observed every April, and it's all about raising awareness of health disparities that continue to impact racial and ethnic minority groups. It's an opportunity to shine a light on how social, economic, and environmental factors influence our health outcomes and how we can work together to promote health equity in healthcare. It's a time to celebrate strength, resilience of minority communities while advocating for better access and resources. And we can accomplish that with our primary care clinic that we've started.
What are some of the biggest health challenges that minority communities face?
So minority communities often face higher rates of chronic conditions. Chronic conditions means long-term conditions that we're living with: diabetes, hypertension, or high blood pressure, and heart disease. There's also some disparities in mental health access, maternal health outcomes, and even life expectancy that's impacted by these. These differences aren't due to biology, which is what we're born with, but rather how we're raised. They're largely driven by unequal access to care, systematic bias, and some socio-economic barriers.
How can community members and partners such as the Zepf Center participate in National Minority Health Month?
Well, you as an individual can get involved by attending community health events, sharing educational resources. We have those in clinic when we see patients, and simply having conversations about health within your family and circles. Organizations and partners can help by promoting screenings, offering culturally sensitive care, and advocating for some policy change that promotes health equity within healthcare.
Well, great. Let's talk about primary care services. Why is it such a critical part of staying healthy?
So primary care is your healthy home base. We often are the first people who detect early signs of illness. We help manage those chronic conditions that I talked about: high blood pressure, diabetes, heart disease, just to name a few. And we provide the preventative care like vaccines, getting you linked with resources for vaccines, and screenings as well. It's also where you build long-term trust with a provider like myself. We get to know you, your health goals, your lifestyle, and the challenges that are associated with those.
So we've talked a little bit about those health conditions, but help me understand how regular checkups can be helpful to people.
Regular health checkups are vitally important. Oftentimes we see new patients that come in for new health visits that haven't seen a provider, in greater than 5 years. It just depends on your access, but conditions like diabetes and high blood pressure, asthma, obesity, they're more common in minority populations, and regular checkups allow us to catch these conditions early, sometimes before even symptoms pop up. And that means that we can start treatment sooner and reduce the risk of complications down the road.
Yeah, I know many people do put off doctor's visits, maybe because of the cost or their busy schedules, or even past trauma. What would you say to someone who's hesitant about scheduling a checkup?
The first thing I would say is I get it. Sometimes life gets busy, and for some, the medical system hasn't always felt safe or welcoming. But your health matters, and it matters to me, and it matters with our primary care. And with Zepf Center Primary Care, we aim to meet you where you are with your health concerns. We offer compassion, flexibility, and there's no judgment in our clinic as well. Come as you are. We'll work with you to make it comfortable and affordable for you.
That sounds great. Zeba, let's talk a little bit about the services that are available. What primary care services does Zepf Center offer?
I would like to start with saying that we offer services across the age span. So whether it's a newborn or, somebody in retirement age and needs a new provider, we offer any type of services that has to do with physical health. I do want to focus on some populations that, since it is Minority Health Month, and that's what we're focusing on, that minority can also include a lot of times like women, and women have statistically, they put their health aside. So we offer a lot of women's health care. This is a great starting point to get things like mammograms, cervical cancer checks, bone density checks, things like that. For other minorities in the Hispanic community, for example, in our African American community, there's a high risk for birth defects or early preterm births. So we do prenatal visits. We can link care up with an OBGYN and also just do minor pregnancy concern visits as well. So again, a great starting point there. For youth population, which can get overlooked quite a bit as well, we offer sports physicals. We can do referrals for childhood immunizations that are often overlooked or not thought about all the time. And then whole family care, that's another big thing, because you can come there and build this trust, not as like just the dynamic of a parent, but also kids, grandparents. It's when you're going to the same provider, being able to be seen for certain similar concerns, a level of trust is developed, and also great rapport and ongoing relationship.
I think what we have to consider too is, as a facility, you may have heard of Zepf Center in the neighborhood as a mental health facility, behavioral health. Our approach is holistic. So we see both. We can refer elsewhere if we need to, but we want to care for your body, your mind, your circumstances that you're going through. We've had patients come in as a family. So we're seeing a mom and her kids are with her. We've asked, hey, are your kids seeing a pediatrician right now? They may answer no or yes, and we're able to link those services with some people who may have not had the opportunity to even discuss it yet.
So, Adam, as you mentioned, a lot of people think about Zepf Center. They think about behavioral health services. And while that's true, people can also start with primary care at Zepf Center, correct?
Absolutely. So you can establish with us first. You can establish with our health agencies for behavioral health, mental health, regardless of how you get to us. Those resources are available as like a spider web from us. So we have the ability to send over referrals to our mental health. We have the ability to send over referrals to some of our substance use disorder clinics. We have the resources in place that help connect our patients with those as well.
I did a presentation recently for our board on integrated healthcare. And as I was doing this, I was kind of in awe about how well the Zepf model fell into integrated health because I see it every day. Our primary care currently is located at our Nebraska location, but our Nebraska location also houses our adult mental health, and it has case managers and it has other services within the same building. And every day we see a case manager maybe walk a client right over to us, establish care right there on the spot, introduce, and a lot of times just be seen on the same day if that client prefers. And it's literally that easy. We have a pharmacy right there in the same building house there, and so they get done with their appointment, they can walk over to the pharmacy and get their medications and leave. We have therapists, readily available. So it works both ways. Even in primary care, we're able to see their needs and say, okay, you need a case manager and you don't have one, so we can establish you with one at this point. So that integration is seen every day, and I think we're like exemplary model of it.
Well, that's great. And I've heard that Zepf Center offers same-day appointments. Adam, how easy is it for someone to get on your schedule?
Very. So basically, you can call our number, and that will be linked in the show notes. Most of our visits, once you're established, are within about 48 hours. We aim to get you in quickly. The spiel that I give most of my patients in the room is that my goal is to keep you out of the urgent cares and ERs. And most patients end up in those places because of limited access to health care. So if they can get in quick with me, that's even better. And oftentimes they end up in those urgent cares and ERs because their previous primary care provider that they were seeing, they can't get them in for a month or so. So my goal is to get patients in within the week. 48 hours would be great. So access to our care, once you're established as well, is very seamless.
Yeah, that's a good point. I know a lot of people do use the emergency rooms for their medical needs, but then every time they go, they're seeing a different provider.
So in our primary care clinic, I'm the one who sees most of our patients. We do have a couple fill-in providers for times that I'm not there, but for the majority of time, a patient will see me, and we're able to establish that rapport. They'll see me every time. We'll establish follow-ups that if they need to be seen on a 3-month basis, a 6-month basis. I see patients weekly if I have to manage some more acute conditions or symptoms. But yeah, for the most part, we're a small primary care for now. And most of our patients are coming back and seeing me every time.
And if I can add to that, I always say primary care is the foundation. It's a starting point for everybody. Everybody needs a primary care provider. Not everybody needs a neurologist. Not everybody needs a gastroenterologist, but you might. And this is where Adam comes in because he is the starting point. You come in with certain complaints, and then he can help navigate that. We do an average of I would say the average is about 2 referrals per new patient to a specialist because we do see a lot of chronic different type of conditions. And those referrals, yes, they will go to a specialist, but Adam gets those notes back. Adam can help manage that care and continue to help navigate and check. And he checks every time they come in for a visit. Did you go see your neurologist that I referred you to? What did they say? Are you on these medications? So it's continuity of care in that sense that you are still with your primary care provider. You might need the extra help and special help that you can get, but he has complete oversight of all of that.
We're kind of like a ringmaster in primary care. We coordinate with all of the area local health systems. So the big 3 in the area that you've most likely heard of, we have access to their systems where we're able to review notes that you may have seen a specialist, and we can coordinate that care as well.
So it seems like a lot of work for Adam and Zeba for you to take on all of these services for the community and still be able to provide same-day access. How do you guys manage all of this?
So one of the interesting things is that we are all about community connection, and there are a lot of community resources, and we do utilize and partner with several different entities within the community to help navigate and also to help provide the best care we can for our clients. And good examples of that would be we partner with the health department. So we have them bring out their NOS vehicle that comes out once a month, and they provide provide free rapid testing. And when I say rapid, you can get tested for HIV, syphilis, and hepatitis C right there on the spot and get results within 20 minutes, screening results. And if anything does screen up positive, they can walk over to primary care, established care, and be under Adam's management to be able to be taken care of and get further testing if needed. So same with partnering with Mercy Health. We have partnered with them for their mammogram mobile unit to come out every other month. That is by appointment only, but we get phone calls all the time from people in the agency that are asking questions about how do I get a client hooked up with the mammogram vehicle. And it's fantastic because where Adam's able to give a mammogram order and they're able to come back right there at the Nebraska location and go and get these services. I have had employees of Zepf personally tell me that they were able to go and get services there, and it was very, very professional, and it was actually more accommodating, and they felt more comfortable than going to a big hospital setting and getting their mammogram at an image center. So we are every day trying to partner with different organizations to bring services and make them more accessible to our clients.
I think that's really the key too, between making the positive connection with people and the accessibility. I think it's why many of our staff and our board members, in addition to our clients, have selected Zepf Center's primary care for their care. Do you have any special programs for uninsured or underinsured patients?
Absolutely. We offer a sliding fee scale that can help patients who are underinsured or uninsured. And we accept most insurances. Our goal is to make care accessible. So no matter your financial situation, we want you in the doors where we can help.
And even if you are insured, we follow the poverty guidelines. So if you are insured and you come in with commercial insurance, but your pay might not be enough to be able to cover your full visit, we also then follow the sliding fee scale on that as well. We always say that we don't turn anybody away due to any type of insurance or lack of insurance or their residency.
For someone coming to Zepf Center's primary care for the first time, what should they expect?
They should expect a warm welcome. We'll review your health history in the room. Our medical assistants, they take a great health history. We can review any health history that you've had with previous providers, which is also great. We go over your current concerns, our goals together. You'll meet me or one of our other providers. You'll get any necessary labs, screenings. We'll link you with services for vaccines, specialists, and most importantly is you will leave with a clear next step. It's about building the relationship between you and I and a care plan that fits for you as an individual.
How do our providers work with patients to create personalized care plans?
This may be the most simplest question that you ask for me today. How do we create personalized care plans? We listen. We ask questions, we learn your story, and build a care plan for you and with you. That might include lifestyle changes, diets, medications, mental health support, referrals to specialists. I tailor the needs for you. This is not a one-size-fits-all model.
For listeners who want to start prioritizing their health today, what steps should they take?
Firstly, start small. Schedule your overdue checkup. Come and see me, please. Drink more water. There's so much that can be accomplished just by keeping the body hydrated, getting active, going for walks, taking your medications regularly if you are prescribed those. That's very important. And talk to someone how you're feeling. Most of the time, new patients, when they establish with me, will spend 30 minutes talking about their life and how we can impact their health journey. And I say that because your health is a journey. It's not a one-time event. This isn't a one-and-done type of thing.
And we spoke about the barriers earlier, especially with minority care. There's so many barriers. There's language barrier. There's past history barriers. There's access to care barriers. There's just the stigmas that are attached with certain minority groups that causes them to have a barrier to want to access care. So a great starting point is just to start, simply to start. Like Adam said, make the appointment, come in, and it starts with a very simple walkthrough of what their needs are and what we can do for them. And there is plenty that we can do for them. And if we can't, we will figure out a way to. And when I talk about these barriers, we are not just looking at their health, but we're also looking at these barriers. How can we accommodate? We accommodate language barriers. We accommodate, transportation barriers. We definitely can help with that. Whether they need a case manager or whether they need a call through their insurance for cab services. Trauma barrier is a big one because Adam does see a lot of clients that also receive services in our behavioral mental health departments, and we're very, very aware of that there is trauma history there. So we take that and we respect it and we acknowledge that. So that is another big one. And then it's just a lot of people are scared to just start. And what I can say and what I advise is that take the step, start and just see how you feel about it. It's okay to come into an appointment and sit there and say, I'm scared. I don't know where we're going to go from here. I think most people, once they're sitting there, they will realize that they already took the hardest step.
Absolutely. And I love to hear you say that you are going to support them with the barriers that may be in their lives, because we've talked a lot on this show about Zepf Center being a trauma-informed agency, and that obviously extends to our primary care services as well. That's wonderful. How can family and friends support each other in staying on top of doctor's visits?
Well, you are your best health advocate for yourself. Aside from that, you need to be each other's accountability partner. So remind each other about appointments, offer to go for support, 2 visits if you need to. Make it a shared goal. So if you are in a relationship and one of you is seeing a provider and the other is not, encourage the other to make that visit. If you both are without providers, come and see me. If it's a whole family, I can see you from 6 months to whatever age you decide that services are still appropriate for you. Health is easier to manage when you're not doing it alone, and we're here to make that step much easier.
What would you say to someone who hasn't seen a doctor in years and is nervous about scheduling that first appointment?
It's never too late. I've had new patients establish with me in their 80s. I've had new patients established with me right after they were dropped from their parents' insurance. You're not alone. We're not here to judge. We're here to help. Just take that first step. Come and talk to us, and we'll walk with you from there.
This has been such a great conversation. I'm feeling very comfortable with you guys. I hope our listeners can sense that you're really invested in taking care of people and helping them manage their own health. If listeners take away just one thing from all the things you guys have discussed in this conversation, what should it be?
My take on this is your health is worth it. Your health is worth your time. Your health is worth your attention. You don't have to be perfect. You just have to start, and you just have to show up. We're here at Zepf Primary Care to support you every step of the way.
I would say that we are primary care, but we are also whole care. We see a patient beyond just their physical health. So we do see, we use that word barrier quite a bit today, but we see all the barriers, we see all the anxieties, the fears, the ideations that they might have already established in their heads before walking in. And we are able to see that and acknowledge that we're people too. We also have to go to providers. We also have to face the same kind of anxieties and the same testings and, whatever life throws at you. So we are very compassionate about that. I think that most of our patients will say as they leave our department is that they received very welcoming care. Once you come in, you will get to know the names of, our staff, and you will recognize their face. And, we have flyers in the community with Adam's face on it. And I've had people point and say, that's my doctor. And, and get very excited about it because we do become more than just a name or a face, and we become part of their life. We're there to care for them in a different type of way, but in all types of way that we can, where we can provide the resources.
Yeah, I think it's about that connection that you're making with people. And thank you for coming on JJ's Clinical Connection today. It's been a pleasure to speak with both of you.
You're welcome, JJ. Thanks for having us.
Yeah, absolutely. Thank you.
Those were some powerful reminders. Thanks to Zeba and Adam for joining us today. To everyone listening, taking care of your health isn't just about doctor's visits. It's about making choices today that support a healthier future. If you've been putting off a checkup, consider this your sign to schedule one. Zepf Center is here to help, whether you need a routine visit, chronic care management, or connection to additional healthcare resources. If you enjoyed this episode, be sure to download and share it. For the latest clinical connections, subscribe to Spotify, Apple Podcasts, or wherever your favorite podcasts are found. For more information about primary care services and other resources mentioned in this episode, check out our show notes. To schedule a same-day appointment with Zepf Center's primary care, call 419-841-7701, option 7. For more information on Zepf Center, visit us at zepfcenter.org or find us on Facebook, Instagram, and LinkedIn. Until next time, this is Dr. Jennifer Jansen signing off.